Hey everyone, Harold Fisher here again, anchor and host of the Daily Drum on WHUR. Welcome to another edition of HUR at Home on HUR.com and all of our social media platforms. February is Heart Month, and this year the need to get heart healthy takes on an even added level of urgency because of the coronavirus crisis and its impact on people with chronic diseases. Well, tonight on HUR at Home, my guest is Dr. Yolanda Lewis-Ragland. She's a fitness and wellness expert, but she is also CEO of the Dr. Yolanda Cares Foundation Incorporated. And tonight she's shining the spotlight on heart health with her third annual Heart to Heart Red Carpet Affair. Hey, Doc, how are you?
I'm well, thank you. How are you?
Good, good. How's your heart?
It's excellent. Thanks for asking.
Well, you have to ask.
I appreciate that. I appreciate it.
Well, let's talk about everybody else's heart. This is a difficult year for a lot of people. The past year, even more so, when you consider African Americans and heart disease. From your perspective, how has the pandemic impacted people with heart disease?
Good question. So thank you for having me. First of all, the pandemic, of course, prior to COVID-19, heart disease was the #1 killer for African American men and women. However, women started to outpace men in heart disease just in the last 4 to 5 years. One of those things, we want to compete, but we don't want to compete in heart disease. So here we are, we bypassed men. And now COVID, of course, right now is the #1 killer of all people, but it is more pronounced and more deadly in communities of color. And the reason is because of low-lying diseases, underlying rather diseases like heart disease, like diabetes, like obesity. And so one of the big issues is we have to address these health disparities and these chronic diseases. And so heart disease is even more important for us to call attention to in the backdrop of the pandemic.
What you've just shared with us is not new.
Right.
The only complicating dynamic, of course, is the COVID-19 pandemic. Do you believe that, particularly for African Americans, they are going to listen more, or are they still not getting the message?
So I do think we're going to listen more. I think that people are scared. I think that people are finally realizing that heart disease, diabetes, these chronic illnesses that we've been living with. And here's the sad part. They're chronic diseases because we're not addressing them appropriately and getting ourselves out of these situations. Hypertension, many of us are born in some situations. Unfortunately, it's genetic. But we are contributing to it with our diet. We're contributing to it with our lack of exercise. And so I think with us dying at a higher rate, not just getting sicker at a higher rate, but actually dying at a higher rate, I think people are beginning to understand that we have to address these underlying conditions. Otherwise, we don't expect another pandemic, but something else is going to happen. You have to understand that. You have to know. So I do think that people are starting to pay attention. I think America in general realizes that health disparities is not just a buzzword. It's now recognizable that it's killing us. It wasn't just that we didn't have access. It's that our actual stress, our actual, obesity, all of these things that we've been dealing with, just because we had to. We can't continue to live like this because something else is going to come around the corner. And because we're susceptible, we are going to suffer more. So we have to address these issues now.
But it's not like a broken arm. You break your arm, you're going to address it right away. But if you have heart disease, if you feel fine today, if you have high blood pressure, if you feel fine today, if you are a diabetic, if you feel fine today, then I'll deal with it tomorrow or the next day or not at all.
Absolutely. Absolutely. No, and you're making a very valid point, which is why education, for me, the key is education. The key is education. The key is resources, really recognizing that we can do things differently, and it's about lifestyle. So if we are learning to make these changes, if, interestingly, so I'm a pediatrician as well, and I often have patients who have these chronic conditions, like let's talk about something that's not heart disease for a minute. Allergies. They don't realize they're not breathing well until I give them a treatment and allow them to breathe, right? Once they realize what it feels like to actually take in a good deep breath, and then they go back to not breathing well, now they know how much they're suffering. With heart disease, it's the same way. Once we show people what it feels like to get good exercise, to eat good nutrition, to deal with your stress, maybe some stress, some self-care strategies, then you begin to learn how to listen to your body, and then you'll know that fatigue that I'm feeling, that lethargy, these headaches, these aren't normal. But when you live like this for so long, headaches become something you get daily. You're not supposed to have daily headaches. You're not supposed to be lethargic. You're not supposed to feel terrible after you eat. So we have to begin to show these alternatives in lifestyle so that people can understand what vitality feels like, so they'll begin to listen to their bodies better.
There is a question that is somewhat off point, but we try to entertain any of the questions that our listeners and viewers have, and if you can't answer this, certainly we may look into this and try to get this question answered for this viewer. But she's asking, for people with autoimmune disease, should they get the vaccine? And that is, I know that's not part of the issue here, but if you have some thoughts about it, I'd appreciate it if you'd share.
So one of the things about autoimmune diseases is that your immune system is already actually compromised. And so it's very difficult to mount a great response when you have an autoimmune disease. So it depends on what the autoimmune disease is. That's actually, it's not a simple question as it sounds. They're not all the same. Some autoimmune diseases, I would say yes. Some I would actually say check with your primary care provider, find out all the vaccines aren't the same. So we want to know, are you considering Pfizer? Are you considering Moderna? What is it that you're considering? And what other things are you battling? So it isn't an answer I'm going to completely give, because I don't want to give medical advice, but I will tell you that every person with an autoimmune disease, they're going to mount a different response. And so for some of them, we want them to get it because they don't mount a great response. For others, it's the type of autoimmune disease that's going to make it difficult for the vaccine, for them to actually incorporate it into their bodies.
Mm-hmm. So
that's a primary care question, but it's not a blanket no, just because you have an autoimmune disease.
Well, there you go. That was from Selena, who kind of chimed in online. So definitely, Selena, check with your primary care or your specialist for those kinds of critical health questions. I do want to talk about your third annual Heart to Heart Red Carpet Affair, since you are dressed for the occasion right now. So this is the third year.
Yes.
But gosh, how are you even doing that this year? Is it like everyone else? Everything is virtual?
Yeah, so it has to be virtual. Interestingly, I contemplated not having it. I loved what we did the first 2 years. We got it. We got the kids involved. And my message as a pediatrician was that we had children educating adults about heart disease. And the reason I started to do that is because there are these heart-to-heart conversations we need to have. We often talk about heart disease in 40-year-olds and 50-year-olds, right? And we kind of wait till you're an adult. I was tired of going to red dress events and we're talking to adults who you've already been talking to, and I don't know that they're getting the message. What I will tell you is, as a child, when I found out, and I was at a health class, and I found out that smoking caused black lungs, I came home immediately and said to my mother, do you know what those cigarettes are doing to you? And I can tell you, within a week, she stopped smoking because I was relentless. As a kid, once I found out this is bad for you, what are you doing? What I know about children is, every time I talk about health and weight loss and my patients, when I tell them that they need to stop eating certain things and that they need to exercise, they will dime their parents out every time. So they would come back to the clinic and they'd say, you said we weren't supposed to eat such and such, what she keeps eating, or mom or dad keeps doing. And I realized kids are really a huge motivator in what we do. So as so my model was, I taught kids about heart disease, and then I use them to educate parents for two reasons. One, we need you to know that if you're not around to be here as a child, then who's going to help us grow up, right? Who's going to be here for us? We need you to do this. The second message is, you need to model these behaviors for us. We're doing what you do. So if you're laying around on the couch, if you're not eating healthy, then we're really doing what you're doing. So the kids were really sort of I use them as messengers, if you will. And it worked great. So I had a great, following. It went well. The pandemic hit, and I thought, okay, what am I going to do? It's virtual. I can't use these kids in the same way. And so I did a little pivot, and I'm actually really proud of the pivot that we made, because I ended up, prior to the event, writing a book, and it's Navigating a Triple Pandemic. And it's 15 of us. It's me and 14 other physicians, and it's healthcare workers of color confront racism in America, health disparities in medicine, and the trauma of COVID-19. So what we're going to do this year is we're actually going to launch the book, and we're going to really talk about those things. We're going to talk about health disparities and heart disease being the number one for us, and that trauma that it caused with COVID-19. We're still going to have events. So, we're still going to talk about heart disease, and we're actually going to have these breakout sessions. There's a yoga teacher that's going to do a 20-minute breakout room. We're going to have meditation for 20 minutes. And then we also have Dr. Ruby Lathan. She's going to do a cooking demo for 20 minutes, and then they get to do another one. So they get to choose two of those. So there's activities, there's the book launch, so it's still really fun. And then we're actually honoring the Mayor Muriel Bowser, for as a heart health champion through social justice, really what she did in terms of Black Lives Matter, because our lives matter. So we actually were able to pivot and use this moment, but I realized there's no way I couldn't have the event. Mm-hmm. What heart disease has been to COVID. It's literally been an invitation to wreak havoc in our community.
Yes, I think you make an excellent point. Yes. Where can people find out more information about it? Give me some dates, some website information, and what should we wear?
So you should wear red. I'm laughing because you're like, I'm already dressed for the occasion. I've been wearing red all month. So I want you to go to, we actually are on Eventbrite. The event is Sunday, February 28th. It's from 6 to 8:30. It's free. So go in, get your free ticket. We have a website, Dr. Yolanda Cares Foundation.
Hold on, slow that down. So
DrYolandaCares.org, because that's the Dr. Yolanda Cares Foundation. So it's DrYolandaCares.org. Okay. You can go on there. You can go on Eventbrite as well. Again, the event is Sunday from 6 to 8:30. But first, in the morning, if you're so inclined, we actually are doing a virtual 5K walk where we're raising money for the American Heart Association. One statistic I have to say, and that is 49% of African American women have heart disease by age 20. This is an American Heart Association statistic. And that means that it happens before 20. It's at 18, it's at 16, it's at, in fact, one of my Red Couch conversations with an 18-year-old who suffered from hypertension and had no idea that's what it was. And she's actually one of the people we're going to be featuring. So it's not just these 40-year-olds that are, out of shape and overweight and fat. No, it's happening to our young people. And so that's why, for me, I'm so passionate as a pediatrician, because it's affecting us. So dryolandacares.org. My Eventbrite is 6 to 8:30, but 5K walk in the morning to get you moving. It's virtual, and that's from 9 to 10:30.
Well, that sounds wonderful, and I hope the weather behaves for that 5K on Sunday morning. I really hope that is the case. Dr. Yolanda Lewis-Ragland, thank you so much for talking to us. I really appreciate it, and congratulations on this third consecutive year of this great event.
Thank you so much for having me.
That is it for this edition of HUR at Home. I'm Harold Fisher, and as always, I'll see you on the radio.